So, ma'am, good morning. I am Nonito Serrano from BSN LWG, and today I will be performing the return demonstration of Thorax assessment. So, review the client previous medical records and doctors order sheet if available. So, prior to the conduct for the procedure, first I'm going to review my client's previous medical records if available for me to identify instances of harm, medical history, and current treatment procedure, and determine the scope of assessment needed to prepare the necessary equipment. So she can determine the scope assessment, which include the anterior and posterior thorax and lungs, using the EIPPA or renew the inspection, palpation, percussion, and auscultation. Then prepare the necessary equipment to be used so we can avoid stopping during the assessment and for us to conserve time and energy. So the equipment include our skin marker, centimeter roller, and also the stethoscope. And perform hand washing then gloves if deemed necessary. So after that, perform the hand washing to protect myself and the patient from infection and cross contamination. So good morning, sir. I am Nonito Serrano. I am your student nurse for today. So for verification, you are
Angelo Lopez.
alright. So how about your birthday?
July 6th.
So sir, how would you like to call you?
Yeah.
So Mr. Jello. So today I'll be doing class assessment, which means I'm going to ask you to stand up, sit down, take off your shirt, and also palpate or touch your upper extremities. So will that be all? So sir, thank you. So do you have any concerns or clarification? So sir, I'll be asking you to take off your shirt.
Okay.
So this time I will check the respiratory distress or problems with oxygenation observed, color of face, lips, chest, and fingernails. So, sir, I will be palpating your trachea, which means I'm going to touch your neck, and it will be okay for you.
Yes.
Can you give me your fingernails, sir? Both hands. Okay, good. So, sir, uh, are you experiencing any difficulty in breathing, shortness or breath, or any chest pain? Alright. So, sir, I'm asking you to stand up. Alright, sir. So, sir, this is for me to observe the position of your scapular shift, of the configuration of your chest wall, and also your normal curvature, which are the cervical, thoracic, and lumbar. Alright. So, sir, can you bend? So, this is for me to assess if there are any deviation or abnormal curvature of your spine which you don't have, so you can stand properly and sit down now, sir. Assess the temperature and integrity of all three skin. So sir, I'll be assessing your temperature and integrity of your skin. So just tell me if you feel any pain. Alright. So then I'll be palpating your thorax area if there are any bulges, tenderness, or abnormal movements. And also, I'm gonna place both of my palms over the lower thorax with thumbs adjacent to the spine and my fingers stretched laterally. So can you take a dip with sir 3 times? Thank you. So for the palpated, the thorax of vocal, fermitus, and faintly perceptible vibration. So place the palmar surfaces of your fingertips or the ulnar aspect of your hand or close fist on the posterior thorax, starting near the apex of the lungs. And ask the client to repeat such words as blue moon or 1 to 3. Repeat the two step, moving your hands sequentially to the base of your lungs. Start toward the midline at the level of the left scapula, or move symmetrically downward and out to cover the lateral portion of the lungs, arch and the bases. So, sir, I am gonna ask you to count 1 to 3 whenever you feel my hand touching your back.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Alright, thank you. Compare the perimeters on both lungs and between the apex and the base of each lung using either one hand and moving it from one side of the client to the corresponding area on the other side, or using two hands that are placed simultaneously on the corresponding areas of each side of the thorax. So sir, I am going to ask you to bend your head and fold your arms forward across your chest. I'm gonna forecast your intercostal spaces in a systematic sequence. Then compare one side of the lung with the other and forecast the lateral thorax every inches, starting at the axilla down to the earlobe. Percus in the intercostal spaces at about 5 cm to 2 inch. Intervals in a systematic sequence. Compare one side of the lung with the other. Percus the lateral thorax every few inches, starting at the axilla and working down to the earlobe. Sir, I need you to exhale and hold at least. This is for me to identify the level of your diaphragm and measure your diaphragmatic dispersion. Sir, can you inhale? So, now I'm gonna repeat this process on the other side and repeat the distance between the expiratory and inspiratory level of dullness. So, sir, I need you to exhale again and hold it please for me. Then sir, can you inhale again? And after that, mark it. And place the diaphragm of the stethoscope firmly and directly on the posterior chest wall and the apex of the lungs at say center. Okay, now, sir, I'm listening for breath sounds. I need you to inhale and exhale with your mouth open. And using the systematic ladder pattern and use the percussion, listen at each point to the breath sounds during the complete inspiration and expiration. And compare the findings on each point with the corresponding point on the opposite side of the thorax. Note the location on the chest wall where adventitious sounds are heard, as well as the location of sounds within the respiratory cycle. Okay, sir, I need you to repeat the word 99.
99. 99. 99. 99. 99. 99.
Okay, now I need you to say the word EE.
EE. EE. EE. EE. EE. EE.
So, okay, sir, I need you to whisper the phrase 1, 2, 3. Okay, sir. I need you to lie down on your back here in bed. Okay, sir. I need you to tell me if it hurts anywhere while I palpate your anterior thorax, and I need you to inhale and exhale deep, sir. And move your hands vertically downward toward the midline at the level of the wrist outward of the best to include the lateral aspect of the lung. Repeat the sequence in palpitem for cubitus firmitus in the anterior thorax. Place the palm of your both hands on the lower thorax with your finger laterally along the lower rib, each on your thumbs along the costal margins. Ask the client to take a deep breath while you observe the movements of your hands. Begin percussing above the clavicles in the supraclavicular space and proceed downwards to the diaphragm. Compare the lung on the other side to the lung on the other side. Displace mouth breath to facilitate percussion of the lungs. Okay, sir. Now I will be percussing your anterior thorax. Auscultated the tibia and anterior thorax. Place the diaphragm of the sternus firmly and directly on the anterior chest bone. Auscultated from the apices of the one slightly above the clavicles to the bases of the lungs at the sixth rib. Ask the client to breathe deeply through the mouth in an effort to avoid transmission of sounds that may occur with nasal breathing. So, sir, I need you to inhale and exhale deeply through your mouth so we can avoid transmission of sounds that may occur with nasal breathing. Sir, sum up everything that we've covered. Your spine is vertically aligned and straight while palpating for your anterior and posterior. The thorax, your skin is intact. The temperature is uniform with no tenderness or masses. So while I was listening to your good sounds, it was also normal, and your breathing pattern is quiet when and effortless respiration. Basically, everything normal, sir. That's all. So, do you have any clarification or concerns? That's all for today. Thank you for your cooperation, sir. So, after assessing the talks, perform the hand hygiene. And document findings in the client record using printed or electronic forms or checklists supplemented by narrative notes when appropriate.